Welcome back to another episode of Confessions of a CRA. Today, I have a very, very special guest, Dr. Correa, and I am so excited to bring her to you today. She actually is currently the vice president of one of the top pharmaceuticals in the industry, and she possesses over 28 years of clinical research experience, including bench work, clinical site, CRO, large and small pharma clinops, and she has, a wide experience in a multiple range of therapeutic areas. And not only that, she sits on several boards, one being CA or CAM Care Health Corporation, correct me if I'm wrong,
Right.
a federally qualified healthcare center providing healthcare services to underprivileged and communities in New Jersey, and the alumni board of East Carolina University. So welcome. I'm so excited to have you here today.
Thank you so much for having me. I'm honored. This is great. So it's kind of like where your world starts as a CRA. So I'm very excited.
Right. Yes. So you have so many wonderful gems and nuggets and diamonds to share with everybody. So how about we start with your education and, where did you start, how you got started with your education and, how that may or may not have been in line with what you're doing today.
Awesome. So actually, it's funny that you ended with my being on the alumni of East Carolina University, because that's where I started my education. So my undergrad was with East Carolina University. I got my bachelor's in biology. And like many people, I had no idea what I was going to do with that. I had thought in my head I would go off to medical school. So that didn't work out. And I was like, okay, so I got to find a job. I got to do something with this. And I know that I love science. I know that I love healthcare, and I know that I love people, just being in a situation of what I have went through in life and different things with my, the health of people around me. So that was very near and dear to my heart. So I had the opportunity to, as you know, get a job, lab bench, bench work, working at Sibagagi. And every day of that job, I was looking for a job. I was like, I don't want to do this forever. Nothing against people who work in a lab, but for someone like me who's outgoing and love to talk to people and everything, doing experiments all day, it just did not work for me. I was like, I got to talk to people. I got to get out. And I just felt so closed in. I mean, I did love the people I worked with. So I met some dear friends there, but it just wasn't for me. So I actually were looking for a job, and I saw this job as a study coordinator, and I was like, what is that? And so I went and interviewed, and I got the position. And I was a study coordinator in asthma and allergy clinic and RTP, Research Triangle Park, in Raleigh. And I loved it. I was like, oh my goodness, I get to work with patients. I got to learn more about research. And it was just amazing. It was just like foundational for me to just start getting to this area. So of clinical research and drug development. While I was there, I had someone recruit me to become a CRA, kind of like many other people. And again, I was like, I don't know if I could do this. I'm going to be traveling and things of that nature. And I'm like, can I do this? But I was so excited. Being born in Germany, stuff like that didn't scare me. So I was like, let's go for it. So I got the job as a CRA. I was working at the time at a place called ClinTrials. It's one of the first foundational CRO companies or contract research organizations. I ended up being there for 10 and a half years. We went through many names, as you can imagine. And during that time, I realized that I wanted to grow. So I constantly was increasing my education. I went back and got my master's while I was there on the weekends. And I just kept going up as a CRA, CRA1, lead CRA, CRA manager, clinical trial manager. And so taking that up, associate director. So I really had the opportunity to grow under some great leadership when I was there. And then it was time to go to the pharma world. So I was lucky. I feel like I was blessed to have the opportunity to get at Sanofi Aventis to apply there at a position. I started out in the cardiothrombosis group, and then I ended up leading all of the North America project leaders at Sanofi Aventis. And that was absolutely probably just a dream job, because I met some amazing people. I had a great boss. I used to work for a guy named Bill Jordan, who actually retired it's one of my dearest friends to this day. It's a leader in the industry. And then I also worked on a young lady, a lady by the name of Dr. Amy Nadamutu, another amazing woman. I learned so much from them, and they helped grow me as a young woman and as in my career, as well as when I was at clinical trials. I had some very good leaders, so that just kind of just grew me, and I just went from there to the next roles, from Sanofi to Pfizer to Adair to Rocket, and now at Takeda, and I love it. So it's been
Awesome.
amazing. Yeah.
Wow, that's wonderful. So would you say like the CRA role kind of fell in your lap then, since someone came to you as a study coordinator and asked you about the role?
I do. I really do. I mean, I really do. It was funny though, because I was kind of like, do I really want to do this? I'll just stay a study coordinator. And one of my dearest friends, she's no longer with me. Her name is Connie Powers. She passed a couple of years ago. She was a study coordinator with me, and she was like, you don't want to do this forever. You want to be a CRA. She used to always say that to me. And I'm laughing to this day. Oh my God, I miss her so much. I'm laughing to this day because she was so right. She was like, Karen, you can do so much more. You're not just a study coordinator. So I want to just thank her from heaven that how she was like, you can do this, go for it. And I did, but it did kind of land in my lap. But I think the first concept is just having the opportunity to be a study coordinator too,
Right.
because it was that opportunity. And I just literally was just going through the paper.
Right.
And applied for a position.
Right. And study coordinator is actually one of the 3 primary goals that I always recommend to people. The other 2 being CTA and then in-house CRA. If you can get it, of course, because that's a little bit more challenging.
Right.
But I always refer to those as the primary gateway roles into becoming a CRA, because they truly are. They give you a strong foundation, and then it's kind of like that's the go-to, right, for the CRA funnels: study coordinator, CTA, in-house CRA. So that's awesome. Wow. And then just side note, I've never met a VP or anybody on that higher level that started as a study coordinator that was a CRA, because I feel like a common I don't want to say complaints, feedback rather, that people have is that, everybody at the top, they don't really know what it takes at the bottom to actually run and execute the trials,
Right.
right? And there's this huge disconnect because they set all these goals and these expectations and these metrics, and then in reality, they don't always line up with what is reasonable. So I think that is like, I mean, as we go further along, I definitely want to explore that and how you feel like that prepared you in your role now, and the difference between you and maybe some of your other peers who, they just kind of popped in as a director or VP, and they didn't have that strong foundation like you do.
Agree.
Yeah,
Yes.
I can imagine. So what would you say would be the key? I know you mentioned you had some great leaders when you were at your first company, where you went from CRA and then you just kind of quickly progressed to other roles within that same company. What would you say would be the key to how you were able to navigate your career throughout that same position so quick? I mean, that same company so quickly.
To be very honest with you, I mean, I didn't realize it, but I think I feel like I attached to people. I attach myself to people in reference to I love to learn. So, and I always I'm a very observant person. So I look at people and I see something they have, and I don't want what they have, because that's coveting. I don't covet what someone else has, but I look at how is it that I can get there. And so I ask questions. I ask, what did you do? What do you see in me that I might need to work on? And I I try to look for that feedback. Dr. Ubafka Denova, I think she's at Parkdale still, if I'm correct. Amazing mentor. She was very honest with me. And one of the first things she told me is that you have to dress for your next position. And I was like, what does that mean? And I was like, dress for my next position. And she gave me some really good advice, and fun advice too, some funny things that she used to say to me. But she used to always say, you need to make sure you're carrying yourself, you're focusing on learning, you're going above and beyond. And I would always do that, no matter what it was. We'd have a CRA training. I've read the protocol. I've asked all these questions. I prayed. Like, I was we went to training, and you would think I was going to train on that protocol because that's how hard I would study for that. So I just always want to make sure that I was, as they would say, at the front of the class, doing whatever it take. But you said something that I want to just kind of, let people know. It did not happen overnight. I've been doing this for 30 years. I graduated from college in 92. So I don't want to, I tell people that all the time. Some people I look at and I'm like, wow, they became a VP in like 10 years. I'm like, it took me, it wasn't something that happened overnight. It definitely was a lot of hard work and a lot of sweat. It's kind of like the iceberg, you see, it's all that stuff that people didn't see behind the scenes. I went back and got my master's. I went back and got my PhD. I got certified as a CRA. I got my, Cornell course in pharmaceutical certificate. I did all of those things. And then not only did I get mentors, but I got sponsors, which is two totally different things. And I keep telling people, it's not just your mentors, it's your sponsors. Who are the people that's talking about you when you're not in the room, that they know what you can do, what you can deliver? And, keep your word. If you say that you can do something, do it, and do it to the best of your ability. You want people to think about you even when you're not there. So you want to shine. And so I always try to give and do my best, probably sometimes too much, but I love what I do. So I think I can give and do my best at all the time. And sometimes I fail. And there's been times there was jobs I didn't get. There were promotions I didn't get. There were opportunities that I didn't get. And you know what? I just looked at that, that just wasn't for me, and I had to learn to take it and, and say, okay, the next opportunity would be mine.
Right. Wow. And that is a great point. Because people look at the end, right? And then they say, oh, it seemed like it happened overnight, or I wish I could be in her shoes, or, what have you, but they don't know, like you said, all the blood, sweat, and tears that went into going from where you started to where you are now. So that's like a really great point. Wow. That's amazing. So when did you know it was time to go from your first company? Because you had been there for a while, right? And you grew and you had all these opportunities. When did you know that it was time to say, okay, I need to leave and then, think about moving on and going somewhere else?
I don't know at what moment it hit me, but I think there was just a time that I would look at the work, I would look at the opportunities, and I'm like, I've done everything here. There was nothing else that I could do. There was no other opportunities I could apply for or be promoted to. And I was like, it's time to go. And I didn't really want to, because I actually did like my boss. Like I said, Ubafka was amazing. My team was amazing. I had great people I worked with, but it was just my time. So I took the plunge of faith and I applied. I applied to several positions, several of them, obviously I didn't get. And then when I got the position at Sanofi, I knew it had to be a blessing because I was an hour and a half late to my interview. I had planned it all out. I was going to be there on time. And I got on the Schuylkill going to, anybody know about the Schuylkill in Philly? It got shut down. And I was like, this cannot be happening. And I called and I said, if you guys don't want to interview me, I understand. I literally cannot move. I'm stuck in traffic. I left way in time. They were like, no, whenever you get here, we'll just move everything around. I was like, thank you. Because I don't know what to do. I literally could not move. The car was just sitting there for like an hour and a half.
Wow. So. Wow. That's crazy. I guess so. And then to be late for an hour and a half. And then the fact that you still showed up, I feel like is a good story too. Because, some people, they would have just been like, oh, well, I'm too late and just kind of forgot about it. But you were proactive. You called. Like, people don't think about those little things sometimes.
Right.
So that's amazing. And I guess one other question I want to ask about that is for the people that I know you said you had done everything, but at the same time, you still loved your boss, you loved the people you work, you loved everything about it. And a lot of people come to me and they're kind of like in that same position where they don't have anything to be upset about, or like everything's great. So why would I move? Why should I move? For those people that are kind of like still in the question mark phase, what would you say to them should be like that ultimate, I guess, question or determining factor as to whether they should leave or not?
Right. I mean, retention is really hard in any organization. I mean, I want to retain all the people in my department right now, but I also want people to grow. If you don't allow people to grow, you don't also have that continuous diversity of thought. So I really feel like it's important to have people come and go as they need. And some people stay forever, and that's great. It's not about that. I think it's what are you looking for? What is your ultimate goals? Is your goals to be the best CRA? I have a really, really good friend. She's been a CRA this whole time. I used to be her boss at one time. She's still a CRA, loves being a CRA. She doesn't want to do anything else. She's a great CRA. That's her goal. I have different, it's just about what motivates you. I was motivated to become a leader. I don't know, I guess all the time in my life in everything I've done is because I felt like I love grooming other people. I love giving opportunities to other people. And I also wanted to lead differently. I've seen some leaders, don't know how they became leaders, but they're leaders in title, but they're not leaders in character. And I always wanted to make sure that I could have character behind me. And I felt like there need to be more people that look like me at the higher levels. Because again, I can mention in all my 30 years, then there was no one, I don't think I've ever reported to a woman of color. No, I take that back. One time, as when I was a CRO, I reported to a lady named Marty Simpkins, and she's still out there. That was it. In 30 years, I reported to one woman of color.
Wow. Wow. That's crazy, right?
Mm-hmm. Yes, that's very crazy.
Wow. And then now that you bring that point, women generally dominate the industry, but when it comes to your level roles, it's mostly men.
Yeah. But the women are, I got to give it to it. Now, I did report, like I said, Amy Nadamutu, I did have reports, but I'm still a woman of color. I mean, an African-American woman, but I have reports to other women. But
Right.
Yeah, amazing women out there. Cause like Ubafka Denoba, Dr. Amy Nadamutu, like I have, oh my gosh, Christine and Ciso. I've reported to some amazing women that I give hands down the best. Rock stars out here. So there are many out there. So there's more women that are paving the way for other women. And that's what, I'm excited about in this industry. Like this, break the glass ceiling. But I can't, dismiss the fact that some of the most amazing men managers out there too. So men have helped us become those, even better. They've covered us and helped us and guided us, So like I said, Bill Jordan, Brian Meltzer, my current boss, oh my gosh, Dr. Jeremy Chadwick. I've been blessed. I've had some really good leaders that have helped me and groomed me, and they've given me good and bad. Like they've told me the things I need to work on and the things that I do well. And sometimes I think we also struggle with that corrective feedback. We that constructive feedback, like, oh my gosh, I don't want someone to tell me this, I talk fast, gotta learn to slow down. I gotta, I wear my emotions on my sleeve. I gotta remember to take the emotions out and focus on the actual content. So.
Yeah. I talk fast too, by the way.
I know I try so hard to slow down, but I'm so excited. But I realize that that's not a good character when you're presenting, when you're trying to give someone data, when you're trying to provide information. Yeah. So I have to remind myself to slow down.
Yeah, me too. Breathe. I always think about Kim Kardashian because she speaks so slowly. I don't think she does it on purpose, but I always think about that. Like, in my mind, it's like slow motion, but
right.
But like you said, when you're presenting, in order for people to like grasp the concept or get what you're saying, you kind of have to slow it down. So that's funny. But yeah, wow. And I brought up the women thing because. And you can please correct me if I'm wrong, but in terms of like the C-suite and the executive level, it's like, even though women dominate the industry in general, like at the bottom, the closer you get to the top is like all of a sudden, where did the women go?
Where did the women go? Where are the women CEOs, right? Where are the board members, right? Where's the C-suite? Yeah. I think we're getting there. I think there's opportunity for us. I think I think that, we're evolving, and I'm excited to see the women. I mean, when I was at Pfizer, I had the opportunity to be, now mind you, I didn't report directly to her, but so I had a role, I had a job, but I also was the head of diversity and clinical trials at Pfizer. So I had the opportunity to work under Dr. Frida Lewis Hall. Talk about a leader. So first of all, we're talking about a physician, amazing. We're talking about a woman of color, amazing. We're talking about a CMO, like this, everything, every box you could check, she had it. She had poise, she had character, she had integrity, she has everything. And I just would sit beside her and be like, okay, I need to take notes. I just I gravitated to her and I wanted to learn from her. I watched her, I learned from her. There's a couple of things that she did, I still do today.
Wow. So you really had some really great, like you said, leaders, mentors. And then I'm glad you pointed out sponsors, because that's something that I've never heard anybody speak about. Honestly.
They're different. It's completely different. And that's my greatest advice. I do a lot of coaching. And when I coach people, I tell them you need mentors and you need sponsors. And they're not the same. Now, they can be the same person. They could be a mentor, can be a sponsor, but you want to make sure you definitely have sponsors. And I tell people to look that up, learn more about what a sponsor is, and learn how to get sponsors, and learn how to get mentors and appropriate mentors. There's nothing wrong with a friend, but you need that person to pressure test, to validate you, and to confirm you, and to also push you. So
to be honest and hold you accountable. Right. So what advice would you give to people that are looking for a mentor and a sponsor? How do you find one? How do you locate one? How do you know a good one versus a bad one?
So first of all, I tell people that people's time is precious. That's one thing you can never get back. You can't get back time. I don't care what you do. I don't care how great you are. You're not going to get back time. I don't know what happened, but my 52 years went by real fast. I blink and I'm like, woo, where'd it go? So you can't get back time. So I tell people to respect people's time. I tell people to go onto LinkedIn and different networking organizations and introduce yourselves. And when you introduce yourself focused on them first. Okay. Focus on them first. And then focus on you. Because if you focus on someone else first, you've now drawn them in. What can you do for me? I have people send me, they know I do a lot with diversity. People send me a new article and I'm like, oh, I haven't seen that. They're like, hey, Karen, thought this may be of interest. I'm excited when I was like, oh, wow, I would have never saw that. Or just whatever information or, anything, or tell me about something. So I think those types of things is you draw someone in. Then once you draw them in, be very specific of what you're looking for. Is say, look, I would love to, have you as a mentor. I know your time is precious. It could be, a 15-minute call. I'll be very brief. I want to respect your time. I just have a few questions. You might want to send them the questions beforehand, have a quick call with them, and then thank them for their time. So I think it's those types of things. And then ask for a sponsor. You can say, hey, I noticed that you work at company X. I'm applying at that company. I'm not asking you to get me the job or anything. What can you tell me about that company and my interview process? What's that one thing I need to make sure that I understand about interviewing there, or about doing that type of role or stuff like that. So it's different things that you want to do so that you can gain information. So I am constantly on LinkedIn. I'm a little behind because I just had a birthday and an anniversary. So as you can imagine, happy birthday, happy anniversary. I've got thousands of responses I need to do. But people know, if anyone knows me, I respond to every single person on LinkedIn.
Wow.
It is something I do. So people scroll through Facebook at night. I'll scroll through LinkedIn because it's my network. It's my life. And like I said, I do a lot of stuff outside of, my real job. And so I don't never want to not connect with someone, because that person might be the person that opens the door for me when I'm doing something for my community, when I'm helping an underserved community or helping a person or whatever the case. So I don't want to close doors. And my mom used to always teach me, never burn a bridge you might need to cross again.
Wow. Such wonderful advice. And by the way, happy belated birthday.
Thank you.
Happy anniversary. I'm pretty sure you had a great time. I know you said, you told me before you had just got back. So hopefully
I did.
Had a great time.
I did. I had an amazing birthday. It was awesome. It was nice. I went home for 10 days and hung out in North Carolina with friends and family. Best birthday ever.
Oh, nice. I'm I missed you. We could have got together.
I know. I should have told you. I was down there. I did a whole 10 days. I did Greenville
Ah,
and Fayetteville and Charlotte and
you
Winston-Salem,
were down
Greensboro.
the street.
Yes,
We gotta, the next time you come back, you gotta let me know.
absolutely. I will definitely let you know. Absolutely.
Yes. Wow. It's like you just, I tell you this all the time. I think you're so amazing. And that's how we
Thank
connected,
you.
right? On LinkedIn, I sent you a message, you got back to me. And I know you get ain't no hundreds, thousands of messages. I don't know how you respond to all of them. So kudos to you, because I'm definitely behind on mine.
Me too. I'm a little behind.
But that is like so amazing, because I also get people that are like, they would never approach a VP, especially of, the company that you work for and being like one of the top pharmas in the entire industry. They would never approach you. But I always tell people, you'd be surprised, because they try to start at the bottom of the list, and who can I, find that's kind of at the bottom of the totem pole. But you never know, when a director, when a VP, when a president, even when a CEO, you never know who would be willing to, connect. And what's
Never
the
know.
worst, right? And what's the worst that could happen? They just don't respond.
Right. They just say no. Yes. That means that was just keep getting there until you get a yes. I mean, that's it. I mean, and you could even have someone that's at a lower level that won't respond. I mean, some people,
Exactly.
it's not for them. They're not going to be a social media person. They're not going to respond to people. There are some people who don't feel like they need to help other people. There's just people like that. They feel like I've made it, I've arrived, and honestly, I'm with my angel. I'm never going to have arrived. I don't care. I don't know how high I get, what position I have, I don't care what I own, what I have. I'm never, ever above anyone. Absolutely no one. I am right there, because I know that at any moment, my plan is to give. That's what I'm here for. That's my purpose, is to give. To whom much is given, much is required. So I have no problem with that.
Absolutely. Wow. And that's one of the things that I so love and admire about you. Like the humility and the grace and the poise. I mean, it's ridiculous.
Oh, and trust me, when I listen to people and I talk about, like, I hear what people saying, oh, I've applied for positions and I can't get anything. I've tried so hard. And I'm like, me too. I've been there. I've applied for positions and didn't get it. Or people told me about, like, how they have a boss that's really mean to them. I've been there too. I've had people be mean to me. I have people say things to me that I'm looking back and I'm like, can't wait to put that in my next book. I'm just, and I just, look at it and I'm like, wow, did you really just say that to me? Did you really just do that to me? I didn't deserve that, but it's not going to change who I am as a person. Anything that's a reflection on them, because I know I didn't do anything to them. So it's just a reflection on them. And you have to be mindful of that. You can't let people change you. All you can do is change how you respond.
Absolutely. Absolutely. I agree 100%. Wow. So going back to the CRA role, now that you are a VP, I don't know how much you deal with hiring, if they put everybody in front of you, or if it's only like the final
They
few.
don't.
Okay.
I wouldn't have any time of my day. So what I do is, like any other company, in all my prior companies and roles, I always leave my teams. I let them hire who they feel is the appropriate. I don't micromanage their hiring. We have a role or whatever. If they ask my input, if it's someone I worked with before, or if it's someone I'm connected with. Sometimes I'm connected to a whole lot of people. It's like, do you know someone? Like, personally, I don't know them. I'm connected to them, or I might know of them, or something like that. But I don't get that involved in that respect. But what I do tell people, like, if they're applying to my company or any company, I just give them the things that I think that will help them in that hiring process.
Mm-hmm.
Having been on the other table of hiring tons and tons of people, I'm like, here are some steps that I think that will help you. Because I think a lot of people, their resume be amazing. Well, sometimes the resume is a challenge, but their resume usually be good. Their background's good. Their education is good. But then they get to the interview and they're like, why didn't I get the position? And that's where they fail. And I think it's because they haven't had the appropriate coaching to help them articulate what they can do why someone wants to hire them and what will separate them from another. And those are the types of things that we need to do more at helping people get to that level. Because there's thousands of jobs out there. So when I hear people didn't get the job, I'm like, oh, you failed at the interview? Oh my gosh, I wish I could just figure out what you did wrong so I can help you. Because if you got if you got to the interview, you should get the job.
Right.
Especially when there's tons of openings.
Right.
If you failed at the interview 9 times out of 10, it's something, not want to say you did, but something happened during that interview that disconnected you from getting the position.
Right. I always tell the people that I work with that at that point, the job is yours to lose, because they don't get that far just for fun. Like, they're bringing you in for a reason. I mean, that's it, right? Right. And then just so people kind of understand the process. So VPs don't have anything to do with directly viewing applicants. Is it just the managers?
It's just whatever the role is. So like for my company, in my current role, like in any company I've had, so I mean that I've been at as a VP or associate vice president, even though I was a senior director, if I'm not the hiring manager, if the role does not report directly to me, I really I don't usually get involved. Okay. Right. Okay. So even though it might be in my department, if I'm not the hiring manager, like if that person's not reporting to me, then I don't really have a say. And I know in some companies, there are people who are like, oh, well, I know Jane, she's the senior VP of blah, blah, blah. I'm definitely going to get the job. I'm going to be very honest with people. If that's how you get the job, that's not really a good way. You should get the job because you are the right candidate. You're the right person for the job. That's the thing that we've seen in our history for years, where other people then were excluded because they never knew, so-and-so, or they never had those opportunities. I mean, I didn't have anybody in the pharmaceutical industry in my family or in my neighborhood. So then that means I would have never had that opportunity. So I tell people to really have an open mind. I tell my department all the time, when you have an open mind when you interview people, and sometimes you hire someone because maybe so-and-so worked with them and they're like, that's a great person, that's a great candidate. And you're like, okay, well, I'm definitely going to interview them. But then they still need to prove themselves in that interview that they're the right candidate. Right. And so I just tell people again, it's your job to lose when you get to the interview.
Right. I agree. Well, that's good to know, because in my mind, I don't know. I just thought that especially once you get to the end, I thought that they put everybody that they were truly considering in front of, the VPs, the presidents, okay. Well, that makes sense.
Yeah, no, not in any company I have ever been in. Not when I was at Pfizer, not when I was at Sanofi. No, do not need to put them for me. I'm good.
Okay, that makes sense. So what advice would you give to aspiring CRA to outside of, we talked about the study coordinator role, the CTA roles. Once you have that basic experience, what advice would you give to them to say, okay, how they can go from that, whatever that experience may be, to the CRA role? Because there seems to always be that disconnect and that struggle from getting from the experience to the position, because everybody's saying you need experience. And of course, their response is, well, how do you get experience?
How do I get experience? Right. Absolutely. So again, that's where it goes, that mentor and sponsors. So I would start to connect yourself with people who are CRAs or CRA managers or clinical trial managers. Like, connect with those people on LinkedIn and start to get their advice, so that people start to know your name, know who you are. Talent acquisition managers, different roles like that. And then there are a lot of companies that are trying to hire people because we have a shortage of CRAs. Let's just be transparent. There's a shortage of CRAs, and all we're doing is circling people from one company to another. That's all people are doing. I don't know why people want to keep it real. So I think there are a lot of companies. We're just cycling from one company to another. I'm like, oh, she was my CRA at company X. Now she's at company. Okay, I don't know that name. That's all we know the name. So we're just cycling from one company to another. So we have to bring new people into the industry. Just like I had to come into the industry, other people have to come to the industry. But what I think that people could do is make sure that your resume is something somebody can grab their, first of all, your resume should show that you're doing different therapeutic areas and show all the different things you did as a study coordinator.
Right.
I look at some of these resumes and I'm like, who wrote this? Did you write this, or your child wrote this resume? this is awful. So, it doesn't hurt to have a nice, well put together resume, and then, maybe even a cover letter, and then go to companies where you have the therapeutic experience. Cause that's another thing. If you actually are working in like oncology or rare disease, or you are a study coordinator in gene and cell therapy or something, trust me, someone's going to pick you up, because that experience we can't teach a lot of times, but we can teach you how to be a CRA.
Right.
So that's why I tell people, get those, when you're a study coordinator, try to get experience on them very difficult trials, very complex rare diseases. Try to get that type of experience, and make sure you have a lot of good training. I don't know. I was a study coordinator with just a biology degree, but you're like you have nursing. If there's any certifications, things like that, those things are going to help you. So that's the kind of stuff. And I can tell you, there's a lot of companies that's hiring people with no experience as a CRA. I won't mention them because I don't want them to think I'm, supporting them directly because of conflicts of interest. But there are companies out there doing that.
Yeah, I agree. And I try to stay away from names too on this platform. But there are both CRO and pharma companies. And the CROs, they have a little bit more leverage than the pharma. So they bring in like the large groups at one time because they'll train a whole group. So yes. I always tell people that's how I got in with my first position. So, the top five CROs for sure, they all have those training programs, academies. Like they've been, especially now with COVID, it seems like I don't know if you notice the same thing, but it's like ramping up, and it was already, like you said, a shortage before, but now it's like
it's huge.
It's a huge gap. And like you said, I mean, they're going to have to bring in new people, because not only are we recycling, but then there's the veterans of the industry. I feel like there's about to be a large exodus of them retiring. Yes. And I don't know how are we going to prepare for a huge group, especially, right. Especially me being in the oncology world. Most of my colleagues in oncology are like 50 plus. So what are they going to do? Right.
Yes.
50 plus, they're getting ready to retire. So they have to start training new people. So I always tell people now is the time to get in, because they're going to have to start hiring inexperienced people. That's just a fact, or else there'll be nobody left, right?
Absolutely. Definitely. Absolutely. So I definitely say people to get the therapeutic experience. You want something on your resume that separates you from someone else. Right. So if you have oncology experience, if you have gene or cell therapy experience, if you have very ultra rare diseases, right. Rare diseases on, people are going to be like, wait a minute. Okay. I need that. And make sure it stands out. Like we don't want to find what you can do in your resume. This is not a puzzle. I tell people that all the time. If your resume is a puzzle, then you need to go write a book, because that's not what the purpose. Your resume should be. So I should be able to look at your resume, glance, and pick up, that you've got X number of years as a study coordinator, you're a research, you got this many experience, be like, as they say, I don't have it in front of me, but be brief, be brilliant, and be gone. That's what you got to do. Because we get thousands of resumes. So, I don't have time to decipher through I see some people's resume and it's like, it's a booklet. And I'm like, I'm done. I'm like, okay, I can't. I can't help you.
That is so funny. I love that. Be brief, be brilliant, and be gone.
Yes.
Wow. So, that's gonna be my new motto. I think I'm just gonna go ahead and let you know I'm gonna steal that. I'm gonna start.
I didn't coin that one, so let me just preface. I didn't coin that one, but that is a very good saying that people say. And I tell people that all the time.
Wow. But that is so true. Because the people that I work with, they come and when you talk to them, they have so much great experience, but for whatever reason, they didn't translate that well onto the paper. So
that's
you're right. Right. And it's just so amazing how it's so many great people out there, but they don't know how to present themselves in a way to show that they are a good fit. And then, like you said, they get to the interview. Maybe they have a good resume, but they get to the interview and then something, I don't, like you said, I don't know if it's something they say or something they don't say, rather, but there's a disconnect and they don't get that offer. And
They
that,
don't. And I feel so bad. I've known people that didn't get a position, and then they'll come back to me and they're like, hey, I didn't get a job, whatever. And I'm like, what did you say at the interview? Like, did you read the job description? Like, did you truly understand the job description and the company's values and, what they're looking for? And you can kind of listen to what people are saying. And when they're asking, like, listen to the question and answer the question, not what you want, to say, what they ask you, and if you haven't done something, be transparent. If someone says, I'm talking, because when you talk about like becoming a CRA and you're a study coordinator, so you have never, ever obviously conducted an SIV or conducted monitoring or written monitoring process because you've never been a CRA. However, you were a study coordinator. So you have attended an SIV. You understand what the agenda is. You understand what types. So you got to speak from that lens. And you can say, having been a study coordinator for the past 5 years, I have experienced the difference between a well-conducted site initiation visit and a not well-conducted site initiation visit. And so I have gleaned insights from those experiences that I will be able to transgress into when I become a CRA. You got to be able to stick on top of your feet. Like, you know what I mean? You got to be like, if somebody says, oh, that's right, you have, you know what I mean? I'm able to bring those experiences to the table, So you got to, I don't know. It's just got to just translate. And then, like I said, be brief before you be gone. Get to the answer.
Yep. Because some people, they go off on a tangent, like you said, and then next thing you know, they're talking about something that is not even relevant to the question. And going back to your first point about time is precious, and people don't want to spend an hour and then they didn't even get the answers to the questions. You know what I mean? That they had. Right. So that is like an excellent point. And I did want to ask you about, for the people that are interested in going as high as VP and all the many other wonderful things that you've done. Could you give us some insight into, what is the day in the life of a VP at a major pharma company looks like?
Oh, it's busy. It's constant, there's tons of things that happen. So, you have a portfolio that you have to make sure that you deliver on. So you're constantly in the direction of working with your senior directors and their portfolio and making sure that we deliver on, all of the cycle times that you do at a CRO. So it's the same things, but I have to make sure they happen. We have to meet our first site activated. We need to get our first subject in for critical programs, so all of those types of things, just making sure that you're leading your team and working through your team for them to do it, but helping them through that process. So you're constantly in meetings in that respect. You're in a lot of meetings because you're doing a lot of strategy. You're focused on strategies, maybe a portfolio, maybe a strategy on a resourcing situation, maybe a strategy on expanding something, changing something, focusing on something. So there's a lot of meetings. So as a VP, it's really important for you to be able to be attentive during meetings and to be, like I said, to be able to focus and to be able to multitask. And I don't mean multitask like where you're doing this when you're in the meeting, you're not paying. No, I mean multitask where you're able to do this, jump off this meeting and then go to something completely different. And to be able to be, prepared for each one of your meetings, presenting yourself in capabilities, being able to present data upwards, laterally, your stakeholders. You got to be able to relate to. So I tell people all the time in my role, one of the things that I think was the greatest thing that I learned at Takeda, which I love, Takeda is, oh my gosh, just we talk about our values, honesty, integrity, perseverance. And one of the things that we do is relationships. So I truly believe that Takeda values is something that you should have in all of your jobs, no matter where you're at. Relationships is how you get to those next roles. Believe it or not, it is relationships. Mm-hmm. People will remember you and how you work. So one of the things I tell people all the time is when you're in a meeting, be present mentally, emotionally, physically, so that you can, because you only have like a few minutes, like in the room, like you might be in a room, say you are a CRA and you're in an investigators meeting or you're at some training or whatever, how are people going to notice you? They're going to notice you on how you present yourself at that meeting, Are you at the meeting on time? Are you in the front? Are you asking effectual questions? Are you responding? They're going to be like, wow, she is sharp. She knows what's going on. Like, what, you're going to stand out. And then if you're writing trip reports, if you're bringing up data, if you see trends, bring up your thoughts. If you developed a tool, send that tool to your manager. Oh, I sent this tool. It's working for me. I want to share with everybody else. Those are the types of things. And so as a VP, I do those exact same things in my role here. I see something that maybe another department can do. Hey, I'm doing this thing with my department. I want to share this with this department. So believe it or not, those same things, how they say everything you learned in kindergarten. Yeah. That's how I say everything you learned as a CRA, you're gonna use it as a VP.
Wow.
Believe it or not. It's that's what people say. So all you're doing is taking those same skill sets and taking it to the next level. And that's the piece that, it's just that you have to do it a little bit higher, a little bit harder, a lot more work, a lot more people, a little bit more responsibility, but it's all good.
A lot more responsibility.
A lot more responsibility. But it's all.